Hello guys, welcome back to the channel. It's so good to have you guys here today. I'm so excited to have you guys here today. Thank you to those of you that watched my previous video. I hope you enjoyed it. So like I said in the last video, it's going to be a series of topics which entails women's vaginal health. So it's very important to note that you have to follow each episode so you can understand where we are coming from and where we are definitely heading to. Thank you once again to all my new subscribers. I'm happy you subscribed to my channel. I love you. Thank you. Today we'll continue our women's vaginal health topic. So doctors over time has referred to the inflammation or the infection that attack the vagina from time to time in women as vaginitis, and this is as a result of an imbalance of the vagina's pH. However, vaginitis is the general name for all the infection or most of the common infections or inflammations that attack women's vagina. But these infections have a name of their own because for every infection, when scientifically tested in a lab, there is always a name for the bacteria or for the fungus. In as much as the general name for bacteria or infections that affect the vagina is known as vaginitis, there are actually individual names for this infection. Firstly, I'll be discussing bacterial vaginosis. This infection is as a result of the imbalance of the bacteria in the vagina, and it can result from having multiple sexual partners, smoking, douching. It can even be picked from a swimming pool or even the toilet, surprisingly. So please, ladies, stay careful out there. And one thing I want you people to understand is the symptoms of these infections vary. Most women get symptoms and some don't even get symptoms at all. Yes, it is actually very possible. But the symptoms, if eventually anybody gets one, is like itching uncontrollably, fishy or smelly odor when having sex, and it goes further to having a woman having discharge, which the color is different from the usual color, probably more creamier than usual or even greenish in nature. Yes, it happens. So please, women, take this into cognizance. Like, if you are going to wear that tongue and going to the pool, please think about it twice, because you might be coming out of the pool feeling refreshed but with a BV. So please just stay careful out there. And once this infection is contacted, it can be easily treated because over-the-counter pills and medication helps. So you might go to the pharmacist or a doctor and they'll prescribe maybe a pill or a gel that has tinidazole or metronidazole in it, and most times the medications take 5 to 7 days. And please do not skip or stop taking your medication even if there are no symptoms anymore. The more reason why doctors will always prescribe and help you to understand the importance of the continuity of a dosage even though the symptoms are not there, because at that point in time they might just be going into retrogression. Meanwhile, you decide not to take them, and at that point you give them room to regenerate themselves and grow back. So please take your infection medication very seriously. Secondly, another infection that affects the vagina is what we call genital candidiasis. It's also known as a yeast infection. So when you hear somebody say, oh, I have a yeast infection, or somebody says genital candidiasis, just know it is all the same thing. So this results from the imbalance or the overgrowth of yeast in the vagina. Generally, doctors and medical practitioners have made us understand that yeasts grow in various parts of the body. However, when it begins to grow in the vagina, like out of proportion, it leads to a problem, thereby upsetting the pH balance of the vagina. And when the pH balance of the vagina is upset, like I've said before, you are in for one hell of a ride. This genital candidiasis, or a yeast infection, results from several problems, which includes pregnancy. Most pregnant women actually deal with yeast infections from time to time. It results from diabetics. Diabetics is also a cause of getting a recurrent yeast infection every time. A weakened immune system and even sex cause a yeast infection, and the symptoms include itchiness, redness and discomfort in the vagina area, probably the vulva, unnecessary and unwanted discharge, which is either smelly or greenish or grayish in nature. Yes, these are symptoms that occur. Also, women actually experience discomfort during sex when they have a yeast infection. So probably you are in the process of, you know what I'm saying, and it is not feeling comfortable, accompanied with the other signs I mentioned earlier. Please make sure you see your doctor or you visit the pharmacist, because you don't just know what's going on down there. But don't panic, because it is very easy for you to get rid of a yeast infection. Your pharmacist can likely prescribe fluconazole or anything that has fluconazole in it, because that's a very common antibiotics to treat a yeast infection. Thirdly, another bacterial infection that affects the vagina is known as chlamydia. Chlamydia is a sexually transmitted infection because it actually stems from having unprotected sex with somebody that already has or has gotten the disease. In as much as the earlier mentioned infections are also result from sex, but most of them don't actually revolve largely around sex like chlamydia do. So once you're getting a chlamydia, definitely you've been having sex with the wrong person. So you just have to check it. You know, you have to check it. So this chlamydia, in this sense, actually comes with various symptoms on its own, and these symptoms can actually include abdominal pain. It causes fever, it causes painful sex, it causes bleeding in between periods, and ultimately the unnecessary greenish or white discharge we do not want. So please, when you are bleeding in between your periods, when you are not supposed to bleed, or you're having sex and it's really painful, you're having abdominal pain, please visit your doctor. Don't go to maybe a pharmacist to recommend a drug for you, because you have to run a test for you to be sure that okay, you have chlamydia. So you would know, and your medical health practitioner will know the drug to prescribe for you to help you cure the situation. But please stay safe out there. It is not safe. You have to be safe. Please stay safe. Next on our list is gonorrhea. Yes, gonorrhea. So gonorrhea is an infection which one can pick up through having unprotected sex with another individual that already has the infection. Usually the most common way to pick it up is through sex. Yes. So I cannot overemphasize the importance of having maybe just a partner, and even though you must have multiple sexual partners, you can also choose to protect yourself at all times. Yes, please use protections, because apart from you subjecting yourself to catching or contracting these infections, you also have to spend money to actually get yourself cured or treated, which you don't want to. You have better things to do with your money, not you going about treating infections here and there. So please just stay safe out there, because gonorrhea does not respect anybody. But statistics are shown that men actually contract it more than women. And for women, it doesn't just only catch you, like maybe catch you and affect only your vagina. It also affects the eyes, affects the throat. The longer it stays in the body, the more the chances of it spreading to other organs of the body. Contracting gonorrhea and leaving it untreated actually leads or have adverse effects to the human body. It can actually lead to infertility issue, and you don't want to get to a certain age when you're ready to have babies and you cannot have babies because you contracted gonorrhea at a point and you did not get the proper treatment, and definitely is having its adverse effects in the long run. So the symptoms in men and women are basically different. For men, they just have maybe swollen testicles, they have discharge from their penises, and they have itches here and there. While for women, you are bleeding in between periods, you are having abdominal pains, you are having unnecessary smelly discharge, which is not pleasant at all. So the more reason when you are actually experiencing these symptoms and you see them and you know something is off, because like I said in my previous video, the vagina has emotions. The vagina literally speaks to us, but we might just decide not to listen. So when you notice something is off, do not just take it for levity. To be honest, do not. So the more reason why most of these symptoms I mentioned and these infections, and when you see you're actually having anything like that, please contact or go to the hospital or contact your pharmacist or your doctor. But don't just leave it lying there, because they have adverse effects in the long run. And last but not the least is viral infections. These viral infections actually attack most genitals, especially in females. Can be categorized as maybe the herpes, the warts. These infections are like the craziest for me, because I feel like the other infections, with my research I did, the other infections are actually easier to maintain, even though okay, it takes a lot, but these ones are harder to actually keep under check. And when you get the herpes disease, it is usually very hard for it to go. Like, it doesn't go, like you have to live with it for the rest of your life in most cases. But most people get lucky, probably due to the severity of they contacting the virus. But for most people, they have to live with it through, like, to the end of their lives, in which they can pass to their children and a couple of other things. So please guys, the essence of this video in general is for us to stay healthy out there. Like, even though we must engage in sex, we should learn to consciously practice safe sex, because it is of the essence. It's either that or you're signing up for things you do not want, and nobody wants to live like that. Obviously you do not want to. So please, I beg you, if you get any of the symptoms I mentioned, please see your doctor or go to the pharmacist to probably prescribe some over-the-counter drugs for you. So stay out there, stay safe. Thank you for staying tuned with me again on this episode. I'm very happy you guys are here, and I'm very emotional. Thank you guys. I do not take your love for granted, and I really appreciate you being here. So please like my video, subscribe to the channel, share it with your family and friends, share with everybody you know, and please do not forget to subscribe. Like, I cannot overemphasize that. Subscribe to the channel, watch the videos, and I'll see you in my next video. Bye.